Hello everybody, I am Dr. Milind, your orthodontist. Is been here today to explain you certain kind of braces care we need to take at home when you cannot visit 32 Smile Clinic for an emergency. Very important first thing I want to tell all of you is that make sure that you brush every day, twice a day for at least 2 minutes standing in front of the mirror. While brushing, I'm going to repeat it again, which I every time you explain you is that you brushing has to be in a circular motion. You start from one area, come to center, go on the opposite side. You have to brush from inside. At least for 2 minutes, brushing has been very important. Along with the brushing, I already provide you interdental brush. You need to use that interdental brush between your teeth and the bracket so that you can clean the area between teeth and bracket and avoid any kind of infection. Why I'm saying 2-time brushing? Because I don't want any kind of infection in your gums because of not brushing 2 times, and I don't want you to emergency you land up to the clinic because of the bleeding from the gums. Very important, along with the brushing, you need to do a use of mouthwash. If you're using a mouthwash, at least thrice a week at night after your brushing, or if not mouthwash, you can do a lukewarm sort of gargle to keep your gums very healthy during this time. Some patient can get an ulcers around their gums, around their lips, and that ulcer could be because of stress factors. In that case, they have to use a gum paint called as a Dologel CT gum paint and apply that gum paint in affected area twice a day. Don't worry, that ulcers will go off within 6-7 days. Some patient, because of wire poking, they can get an ulcers because the end of the wires can shift on the backside because of your brushing technique, and you can get an ulcers because of that, and it's very uncomfortable ulcers. In that case, I'll advise you to use the end of the pencil. Now, it's very important that you have to disinfect that with all the kind of disinfectant which is available at home, and use that end of the pencil to push the wire away from the affected area so that it doesn't hurt you. If you have chewing gum at home or if you have wax at home, you can apply that there before you can visit to 32 Smile Clinic. If you cannot adjust the wire, very important that you can use a nail cutter. I think everybody at home have a nail cutter. Use a nail cutter very carefully. Keep the piece of the cotton behind the wire area so that when you cut the wire with the nail cutter, it doesn't fall back, it doesn't fall into your throat area. Patient who's wearing an internal retainers, those patients, if the retainers broke because of some reasons, in that case again they can use the end of the pencil and adapt that internal wire retain in that area so that it doesn't hurt you. You can keep a chewing gum or you can put a wax there before you visit to a clinic, or even you can use a nail cutter to cut that piece of the wire so that it doesn't hurt you very sharply. Patient who's wearing aligners like Invisalign aligner, or patient who are wearing retainer, it is very important that they continue to wear their aligner and retainers. If you're going to stop the wearing aligner or retainers, it's going to have a relapse problem in your case, and again treating such cases is going to be problematic for all of us. Make sure that you brush your aligners or retainer with a toothpaste and toothbrush every day, twice a day. If that aligner has been hurting you and because of that you're not wearing the aligners, in that case you can use a nail filer. You can use a nail filer to file that aligner edges so that it doesn't hurt you. If you don't have that, you can use a scissor and you can carefully cut the edge of the aligner so that it doesn't hurt you. But very important that you continue to wear your aligner or retainer so to avoid any kind of relapse. If you have got a loose band or loose bracket, don't immediately rush to the clinic. Give a call to the clinic and talk to the doctor, and if required in emergency only come to the clinic. But it's okay to be there. It's not going to have any major effect in your treatment right now. If you're wearing an appliance and appliance has been loose, continue to wear the appliance and call to the clinic and take an appointment. Very important that don't rush immediately to the clinic. Right now we are taking all appointments on planned basis, and only in emergency situation we are taking up appointments. Otherwise we are telling all the patients to stay home and stay relaxed. Patients who are wearing self-ligating braces, I think they can extend their appointment for 2 to 2.5 months because these are more hygienic braces, so don't worry about that. Patients who are wearing normal braces, where they may have to visit me and they have to give a call to clinic and take an appointment accordingly. I think this is a time which is the first time in a lifetime where such kind of situation is arised. Don't worry, take your time, stay home. I am very confident that situation will come back to a normal in coming days. Enjoy your time and all the best to all of you. Thank you so much.